Hey, welcome to our presentation, our webinar on pressure wave therapy. We're really looking forward to going through all of this with you guys. This is Jeff Rubinoff over at the iRad Sales Group. Today's presentation is coming to you from iRad Sales Group, Regentex, Pain Doc Near Me, and being presented by EMS. We're going to be focused on the EMS Duoclast. I'm going to turn this over to Alex. I'll let Alex do a little bit of a background for himself, kind of go through his background, the practice that he works at, and go into detail into the overall webinar. We're going to start out with a brief PowerPoint, and then we're going to go into live scanning, and so you'll be able to see multiple angles of the live treatment. So I'm going to turn this over to Alex.
Alex, right. Hello, everybody. Can you hear me? I hope audio is good. I want to introduce myself just in a short way. First of all, thank you for the invitation. Thank you for being here in Miami. Beautiful weather, about 25 degrees warmer than in my hometown at the moment. So I really enjoy the stay. We have a little talk about pressure wave therapy. As Jeff already mentioned, we're talking about the Duoclast device. Why is that? That is very simple. EMS is a Swiss company, Swiss-based, and are the inventors of Radial Shockwave, as you perhaps know. First of all, some sentences about me. I'm a PT, I'm a physiotherapist from Germany. I work with the First League soccer and ice hockey team, using the Duoclast device more than 8 years now. I'm a member of the Science Board of Sports Medicine newspaper and have my own practice in Augsburg, Germany. Let's directly go into details. We're talking about the theory in the very beginning, because it's quite important to understand how everything works. Then we will see how shock waves or pressure waves are generated. You will see some cases out of my daily work. And then I've got a live patient here in the area, which basically I have no idea what the issue is. So we will have a little talk with him, find out what his problems is, and then make a live treatment. And at the end, you have the possibility for some questions. So, but what basically are the aims of modern pressure wave therapy? We don't need medication or less medication. We can avoid injections, so as cortisone, for example. We can avoid surgeries. It's non-invasive. We have a low risk level and a high effectiveness, which at the end of the day means we have happy patients and have a successful practice. EMS is #1 in clinical evidence. So that means that more than 50% of all published level 1 trials are done with the Duoclast device. And more than 60% of all these studies showing that cellular and biological effects are done with the Swiss Duoclast device. What are the main effects that we can create with pressure waves? First of all, we can get a pain relief or elimination, increase of blood circulation in the entire surrounding tissue, inhibition of inflammation, activation of processes which allow us to repair the tissue, and we have a muscle relaxing effect. Let's talk about these points in the beginning: pain relief, reduction of inflammation, and the stimulation of natural processes. What is the miracle behind pain relief and reduction of neurogenic inflammation? There comes a substance into on the point that which is called substance P. Why is substance P so important in doing pressure waves? As you know, all kinds of inflammation we have, no matter if it's an acute injury or a chronic process, we have several syndromes which are in charge for this kind of inflammation. Yeah, if you see it from the outside, we have a kind of pain, swelling, thermal increase, stiffness, and functional disability. This is happening in every kind of tissue we have, and this are the 5 main points for inflammation. Now, what's substance P in the neurogenic inflammation? So substance P increases the sensitivity of C nerve fibers and increase the nociceptive signaling, which means after nociceptive stimuli trigger the response, they release substance P by the C nerve fibers, and substance P stimulates the activation of mast cells, leading to release histamine and make a vasodilatation. So neurogenic inflammation is a self-stimulating mechanism that blocks healing process in the entire tissues and the expression of scleraxis. Scleraxis is a transcription factor which is required for every kind of tendon development. So scleraxis is the earliest detectable marker for tendon repair and activates downstream of the differentiation. So whenever we have substance P, we get neurogenic inflammation. The neurogenic inflammation is causing pain. That pain is releasing substance P, and substance P is causing neurogenic inflammation. This circle almost hardly stops or takes a long time, and this is something where the pressure wave device can start the healing process. Because the shock waves or pressure waves inhibit the release of substance P by blocking the neurogenic inflammation. Local anesthetics inhibit the healing, and corticoids inhibit the healing too, because local anesthetics stop the healing process. But what we know is that local anesthetics and corticoid injections are just symptomatic treatments. What I explain my patients, and to make it in a very simple way, is I always show them a chili, a red hot chili pepper. Why is that? Because it's the same mechanism what we do with the pressure wave. Yeah, the red chili peppers contain capsaicin. They are overwhelming the C nerve fibers who are responsible for transmitting the pain, and so they can't activate the neurogenic inflammation. So basically, first it burns and then it goes numb. And the pressure wave is exactly doing the same thing. So the release of substance P out of the spinal cord via the C nerve fibers stops. Yeah? And the pain is not transported to maintain the neurogenic inflammation. So pain first and then recovery. This is the main reason why a proper pressure wave therapy needs to be painful. So if we have less substance P, pain is going down. If we have less substance P, also neurogenic inflammation is going down. This is very important because otherwise we don't get the following steps. So neurogenic inflammation is going down, and now we get a release of growth factors, activation of stem cells in the treated tissue, and an increase of scleraxis, which means the healing process starts. And we also know that especially on the nervous system, the effects are mediated by cavitation. So let's talk about where does it help, how does it work. First, we start with trigger points, yeah, because trigger points are quite interesting about the topic I just mentioned, yeah. This guy is a spine surgeon from Germany. As you can see, we find a lot of trigger point areas. But how is basically the area where we find trigger points? What do we find in these areas? So we find selected inflammatory mediators, neuropeptides and cytokines. Basically, we find a lot of substance P in this area. So every trigger point, and that's why we have these trigger points for a long time and very painful. The substance P is causing a kind of neurogenic inflammation in a very small little area. So by using the pressure wave device, we can decrease substance P, and so we can decrease neurogenic inflammation. This is basically what I just told you before. Now we come to the point connective tissue. Basically, how does it work and how can we treat connective tissue and why does it work? Clinical studies showed that by applying the maximal energy tolerated by the patient and 2000 shocks at a frequency of 10 Hertz, one session per week, we can find significant differences in the treated tissue. Greater reduction of the pain score, greater reduction of the DASH score, and maximal grip strength as in the control group. What is the related basic science study to this? Radial shockwave has a dose-dependent effect on growth and proliferation of fibroblasts. Effect of shockwave is significantly reduced when applied in a solution of 10% PVA. If we look at the clinical studies, for example, for an ACL reconstruction, 6 sessions in total, one treatment per week, 2,500 shocks at a frequency of 6 to 8 Hertz frequency, applying total energy of 0.28 millijoule per square millimeters. We can reduce the pain threshold when necessary a bit, and applying just 1,200 or 1,500 shocks. But what we find at the end is a significant difference of LKS, pain, range of motion, AKDC, at 3 and 6 weeks after treatment. So the application of pressure wave in the early rehabilitation period after an ACL reconstruction is a very effective and positive thing. Or if we look at a clinical study about capsulitis, adhesive capsulitis, 4 sessions, once per week, maximum 3.5 bars and an energy flux density of 0.16 millijoule per square millimeters at a frequency of 8 Hertz with a quite small applicator. We find in comparison to the control group that the pressure wave group presented a reduction of the DASH score of 54 after 4 weeks and also after 24 weeks. If we use a treatment protocol after post-immobilization joint fibrosis, 4 weeks, 2 sessions per week, 1.5 bar pressure, and a frequency of 6 Hertz and 2,000 shocks, we can see the range of motion improves up to 34% compared to the control group. What about muscle tissue? If we look at muscle tissue, this is one of my professional soccer players in the pictures you can see. The first pictures on the left side, so this one and this one, have been done directly after the injury. Then we started to do pressure wave treatment. In this case, we did it every day for at least 10 days and made a control MRI. What you can see is how the fluid in the area is reduced, almost non-available, and we can start with these players to increase the weight and come back into walking, running, and passing. So a nice little study done by a colleague of mine from Germany has been done several years ago about treating all muscle injuries appearing during a season. And what you can see is that according to how severe the muscle injury is, the layoff time could be reduced up to 54%. This could be a modern application of shockwaves with a muscle injury. This is an example of a type 3A soleus muscle tear. What you can see is on the 4th day, we started applying pressure waves, 7,000 impulses in each, starting with 2.5 bar pain threshold and increasing up to 3.4 bar pain threshold. You can see very early starting with the swimming. You see after the 4th treatment already starting cycling, running after 13 days, and then after 20 days in total, we have a return to play of these players. This could be an example how the approach of a severe muscle injury could be. Basically, to make it very simple, all kind of muscle injuries you have. We always set up the device at a frequency of 20 Hertz frequency. Frequency basically just means how quick we can apply a very high intensity, a lot of energy in the treated tissue. So we always set up a high frequency, starting with the pressure 1.0 to 3.4 bar, always at the patient's threshold, and then applying 6,000 up to 12,000 shocks per session, 3 treatments a week. This is the modern way how we treat our professional athletes. What we know out of this study is that the radial shockwave, pressure wave, basically has the potential to modulate the biological function of human skeletal muscle cells. So after this study, we definitely knew that what we are basically doing is working. Let's have a look at osteoarthritis. This clinical study shows us that 4 sessions of pressure wave with a Duoclast device at and an energy flux density of 0.25 millijoule per square millimeters have demonstrated beneficial effects on pain score and WOMAC score up to 3 months after the last treatment session. And also the reduction of the pain score is directly linked to the energy delivered per shock and not the total number of shocks. This is a quite important study, not just showing that the reduction of the pain score is working. No, but what we know out of this study is if you have using a device which is not able to use high energy and give out high energy with every single shot, cannot really reach the same results as we are with the Duoclast device. It's not working just double the amount of impulses to generate the same effects. So every single shot, every single outcome needs to have it. What about neurology and spasticity? It's also the tissue, nervous system tissue, where we need an effect. Out of a clinical study, we know injections of botulinum toxin would not be superior to shockwaves to treat spasticity in the soleus muscle. The effects of shockwave application could last longer than the effects produced by botulinum toxin. Why is that? One approach, and what the scientists found out, is that a localized destruction of end plates in the muscle cells may be caused by differences in acoustic impedance induced by the density of acetylcholine receptors. And this basically is why the spasticity is releases more than by injection of botulinum toxin. What about bone tissue? One treatment protocol for bone tissue repair could be, in this case, even if it's osteosynthesis materials present, is 3 sessions 1 week apart, 3,000 shocks per session, 0.18 millijoule per square millimeters, which is roughly 4 bar pressure, with a 50 millimeter applicator. In this treated group, an average of 8 months lead to bone consolidation versus an average consolidation achieved in 24 months in the control group. So what you can see is that the power of this pressure wave device is able to have a perfect effect on the bone tissue. The osteogenetic effect of shockwave is very complex, but it's definitely dose dependent. Yeah. So radial shockwave has proven effectiveness to induce new bone formation in normal bone and might be advantageous in the clinical setting because of its distribution to larger treatment areas. Limitations might be found in pathologies far below the skin level because of a distance-related decline of shockwave energy. What is the technology all behind it? Because I already mentioned some differences to other devices about energy flux density. So how a pressure wave is generated and what actually are the differences is very, very important. So what are pressure waves? Basically, this is what a single pressure wave looks like. A pressure wave is a sonic pulse that has certain physical characteristics. As you can see in this picture, yeah, you see a high energy in the beginning is very important. So up to 100 megapascal. Look at other devices; they're not capable to reach 50 megapascal, and we need a high energy in the beginning. Why is that? Because the negative phase, which is the most important phase of, as we call it, tensile phase, is the most important phase of every shock wave we are producing, is roughly 1/10 of the maximum. So 100 megapascal pressure in the beginning leads to -10 megapascal pressure in the tensile phase. So if you compare these to other competitors or different devices, they just can produce half of it. So also the tensile phase will be limited, which is leading to not so good results at the end. The stimulation of tissue by pressure waves starts with a primary compression phase up to 100 megapascal, followed by the negative pressure phase called tensile phase. The tensile phase releases the energy from the compression phase. So we produce with a high pressure a lot of energy, which needs to be released in the negative phase of pressure. In this negative phase, the generation of cavitation bubbles appears. A high cavitation level is a result of a high amount of energy density delivered by the shockwave device. So this is basically what the handpiece of the Duoclast device looks like. The pressure waves are generated by compressed air that accelerate a projectile, which strikes a fixed applicator at high speed. So you can see the projectile in here, which hits the applicator and is causing the wave with a penetration up to 4 centimeters. This kinetic energy is converted into acoustic pressure wave delivered in the target tissue through the skin. So we have the positive energy density in this area. You can see it on the right top picture. This is the compression phase. And we have a negative density, the tensile phase, which is causing and leading to cavitation bubbles. And how does a wave look like? You can see this on the picture. This is basically how one shock wave is leaving the tip and entering the tissue. Why is cavitation so important? So why do we need a big negative phase and a lot of cavitation bubbles? Because out of this study, we know that a significant part of the effect of pressure waves in the tissue is mediated by cavitation. And cavitation is consequent to the negative phase of the wave. If we now have a look at different handpieces from EMS and other competitors, what you can see is that even the pressure is not quite important, because when we talk about the pressure, it's just the pressure we put in every single handpiece. The importance is what's happening with the pressure in the handpiece and how much energy can be delivered out of the handpiece. So if you check the different handpieces, we have BTL in the beginning, we have 3 different types of EMS devices, and we have the Storz device, and we have the Simmer device. I forgot about mentioning the Simmer device because, as you can see, there is just no single cavitation bubbles coming out. So we just compare these big 3. What you can see is, yes, it's a bit black. Storz device is a bit black too, but the blackest part are the EMS handpieces. If you now skip over to the right picture, scientists just counted the number of cavitation bubbles which can be found in every single pressure wave, and there the difference becomes more clear. So what you can see is that we find a high amount of cavitation in the handpiece of the EMS device. And the air pressure is, as I mentioned, is not really important to predict how much energy is coming out. A study done by the University of Aachen in Germany was quite interesting. Just came out 1 year ago, 1.5 years ago. What you see in this picture is, this is a measurement of the Duoclast device. You will see later when we do hands-on. And what you can see is that with different kind of frequencies, the Duoclast device can maintain the same energy output. So by increase, but this is at 1 bar pressure, 2 bar pressure, 3 and 4 bar pressure. Yeah, and you see the energy flux density is nearly maintained at a high level. If we now look at the graph from the Storz Masterpulse 200, which has been measured too, you can see the difference. Storz is even capable to put 5 bar pressure in the handpiece, the top line here, and then you see the others, 1, 2, 3, 4, 5 bar pressure. And what you can see is that by increasing frequency, the Storz device loses up to 92% of the energy outcome. And what we know is out of this study that high energy treatments versus low energy treatments, the high energy treatments are more efficient than the low energy treatments. If you look at the studies done in the literature, 90% of all these studies use an energy flux density of 0.1 millijoule per square millimeters or more. If you now compare the study I mentioned before, in the back you see with the blue lines, you see the Duoclast device, and with the red and orange ones, you see the Storz device, and you look at the energy flux density of 0.1. 90% of all studies are done with this energy. So they show that with an energy flux density of 0.1 millijoule per square millimeter, they can achieve these good results. If you now look at the Storz device, there's no setting the Storz device can even reach these energy flux density. So if they try to claim that their device is able to reach these results, it's not possible because energy flux density is just too low. In the QR code, you can read the full story about it. It was a very nice independent study. So a high number of shocks doesn't compensate insufficient energy. This was the second study if you look at the graph before. So just to double the amount of impulses doesn't lead to better results. The output of every single shock wave or pressure wave is important to lead to perfect results. Now you heard a lot of things what the devices are able to do. So everybody can find the indications for a lot of treatments. But also we need to mention or talk about contraindications because it's always very important to talk about. I just go through it. We don't treat over airfilled tissue, lungs or intestines. Think about the penetration of the device. Intestines, we don't need to treat intestines. In this area, there's nothing we want to treat. Lungs, if we treat the upper back we have definitely more than 4 centimeters space until we reach the lung. We don't treat torn tendons if they are ruptured more than 50%. We don't treat pregnant women. I never would treat a pregnant woman in the lower back, but by explaining a situation, it's always possible to treat pregnant women at the feet if they are suffering from a heel spur, for example. Treatment of persons under the age of 22 in areas where we find growing zones. The Osgood-Schlatter disease is an exception. We don't treat patients with blood coagulation disorders, including local thrombosis. Oral anticoagulants are contraindication too. Local tumors or local bacterial viral infections, of course. And one of the most important things is after local cortisone injection, we need to avoid doing shockwave at least 6 weeks. After the theoretical part, we try to switch now to the cases. I have several cases which I can find in my daily work, in my practice. First, one of the most common injuries what we have is all kind of muscle injuries. This is a soccer player, 22 left winger, now playing first league in Austria, suffering from hamstring rupture in the biceps, big hamstring rupture in the biceps femoris muscle. The MRI pictures showed this. You see a lot of fluid in the ruptured area here. We started with Shockwave immediately. Yeah, that's what. First of all, price, of course, yeah, and cooling devices. Then after 24 hours after the injury, we start with pressure wave. Taking the big applicator tip, starting with 2-bar pressure. 3,000 impulses were at a frequency of 20 hertz. 2-bar pressure was the individual pain threshold of the player. Then we continued this treatment for 14 days daily, and then every 2 days. Professional players always need to get daily treatment just because first they can afford it, and second, the downtime needs to be as short as possible. With my patients I have in my practice, daily practice, a rough number is we do a treatment every 5 to 7 days and 3 to 5 to 7 treatments in total. These players are painless very quickly. In this case, after 3 days. Cycling is possible after 7 days, running after 13 days. Remember when we talked about the study of muscle injuries, is exactly the number we reach in this area. Then, depending on passing and team training is working, yeah. After 35 days in total, this player could perform a 90 minutes first league match after all. This picture I already showed before. But also very important thing in these cases is we don't need to wait until we reach a muscle injury. What we did in our youth academy of our soccer club is when we started to treat every reaction of the muscle after the training by doing pressure wave. And what we found out, if we just check the numbers over several years, just counting the severe 3A to 4 muscle injuries in the top 4 youth academy teams, we can see that we had a high number of these severe injuries in the years 2014, 2015, and the first half of 2016. Then we started to use pressure wave as a prevention tool to treat all kinds of reactions appearing during a normal training week. And what you can see with the green numbers is that the severe muscle injuries decrease a lot. So also as a prevention tool, we know repair function, muscle relaxation is a good choice. This is a picture. It's not real muscle, but it's also spasticity. That's why I just want to show you in this case. He's a medical student from Germany. He had an accident after his final exams and suffering from a fracture of C2 with complete paralysis downwards. And he's suffering from spasticity. And his colleagues in university treat him once a week, and he's not needing any medication. We talked about fractures. Fractures not just because of bone healing, but with every fracture we also have many kinds of tissue which is necessary to treat. This was an under-19th national team soccer player suffering from a Jones fracture. After surgery, he got a screw. After surgery, we start immediately doing pressure wave. First day, he got manual lymphatic drainage in hospital, and then day 2 and 3, we start doing pressure wave. First of all, for lymphatic drainage with the big applicator, 1.5 to 2 bar pain threshold. 3,000 impulses at 20 hertz frequency, and then doing a kind of cooling device at the end. From day 4 onwards, we can do full contact pressure wave on the fracture, and from day 11, daily pressure wave with already the small applicator. After 4 weeks, control X-ray, we can see consolidation of the fracture. We allow the player starting wearing an air walker, full body weight on the foot, and start cycling without an air walker. And after 6 weeks, control X-ray, we could allow increased running and training with the ball. After 11 weeks in total, he's fully restored and could perform a match. This kind of fractures, severe tissue problems, you can see it's a fibula and tibia fracture, rear and front syndesmosis rupture. This was were the pictures before we started the first treatment. You can see the massive swelling. It's about inflammation in the whole area, and we did the shockwave. 2 days after the first treatment, pictures you see, it looked like this. And another 3 days after another two treatments, the foot looked like this. So what you can see is how powerful the device is, how effective it can reduce swelling, pain, inflammation, and all these kinds. And then after we reduce the neurogenic inflammation and the pain, the healing process in the tissue, in the bone can start. And we know that even if we have an environment of non-unions or delayed bone healing, it's working. So just to show you what we do, 6 weeks after surgery, you can see that the bone is not healing properly. So we started a treatment, 5 treatments. Now you can see that the colors are starting to appear, and we also can see new bone cells in between. Did another 5 treatments, and now you can see that this bone finally starts to heal properly. Or even if it's worse, if it's a rheumatoid arthrosis, as you can see here, yeah, 8 months after surgery, this client came to my practice. We started to do pressure wave, and this is the result: 10 treatments within 4 months. One of the most common issues we also have with professional athletes are ligament ruptures, because we have huge swelling, pain, inflammation in these areas. So it's also the same tissue repair what we need. This was a German soccer player, first league, ankle distortion during a season game. We can see in the ultrasound the ATFL rupture, massive joint swelling. Starting in this case, we used a high power laser before cooling therapy, before we started with the shockwave therapy. After 12 hours already, with 1.5 bar pain threshold, 20 to 25 hertz frequency, 5,000 impulses, and the cooling device at the end. Result, after 24 hours, this patient was able to walk with full load, no swelling, and pain-free. This is basically how our treatment can look like. Yeah, this is the swelling before. You can see these pictures, how we apply the pressure wave with a 50 millimeter applicator and the cooling device at the end. Daily pressure wave could increase the pressure up to 3 bar and have a total downtime of 19 days for this guy. Or another one, where you can see the huge swelling in the foot. Yeah. In this case, we needed about 15,000 impulses of pressure wave, and this is directly the result after the treatment. So you can really look at it, how it's changing. And we also can show it to the patient what's actually happening. This is a thermography device we're using in our clinic, and you can see it's an ACL rupture after surgery. And before on the left side, and on the right side, you can see the blue color. The whole leg is getting cooler, not just because of the gel, but also. And the most important thing is what you can see is the blood vessels. You see the blood vessels, how they are working. Another one, left picture before, this was after the second treatment, another treatment, and now you see it's running. Bursitis, capsulitis, just as an example, bursitis of the elbow, you see the huge swelling of the elbow, very painful. He had a kind of elbow spur in this area during the treatment. And after 4 treatments, this is the result. No swelling, full mobility in the elbow, no pain. Chronic polyarthritis. This lady is 60 years old, friend of my mother, basically, came after suffering from this 28 years. She is taking painkillers almost every day. Huge swelling, very painful. This is what it basically looks like in the beginning. You see how the joints are swollen. You see the color of each finger and the whole hand. And we did 5 treatments within 15 days, and this is the progress. Half time, and this was the progress at the end. Pain-free. We don't need any painkillers anymore. You see the color changed, yeah, and the mobility of fingers improved. Wounds, always important, yeah, as long as they are not infected. We had this at, when we talked about contraindications, but we're talking about scar tissue, yeah, connective tissue. So this was the beginning, yeah. This was a player suffering from a soft tissue injury in the knee, surgery. We have no tendon injury, just soft tissue. Then after 14 days, before we wanted to extract the stitches, you can see that the short inflammation area started to appear at the outside of the knee. So we decided to use the pressure wave device, first to reduce the swelling in the knee, to improve healing process of scar tissue, and of course, pain inflammation reduction. And after a treatment time of 16 days after the first treatment, as you can see, no inflammation, no pain, full range of motion, running possible of this player, soft scar tissue. This is basically what we need. Low back pain. I will show you a back pain treatment in the live session. But just to show you the study that for unspecific low back pain, there's a study where we can show that pressure wave works perfect. And I also want to make it a bit more exciting for you after showing a lot of cases where we treated patients locally, just to show you what else is possible with the device. So if you look at this player, this is one of my youth hockey goalkeepers, ice hockey goalkeepers, suffering from after a hip surgery. He has a had a hip impingement afterwards, still suffering from pain, lack of range of motion on the left side. Extra rotation is limited compared to the right side. What we did, and very painful, of course, as Vasco 7 out of 10, what we did is by affecting the kinetic muscle chain, just applying pressure wave on the inside of the malleolus medialis, the inner ankle below, applied 3,000 impulses, 20 hertz frequency, and 2-bar pressure. And then made a retest, because we can affect the whole kinetic chain. And what we see is that extra rotation compared left to right now is normal, and the pain score is just 2 out of 10. Then we know where is the little pain left, and in this area we can now concentrate. Last but not least, an important message from me. I'm explaining a lot of things, telling a lot of things, showing a lot of things. But what we also have is a big, big network. So we try to connect practitioners all over the world together to share knowledge, share information, and ask questions. So network is a very, very important point. This is what guided Duoclast therapy stands for. So as you can see, the picture in the left picture, this is the main group of high practitioner doctors and physios from soccer teams working close together and spread around in almost 50 countries all over the world. That's basically what I am doing, yeah, hopping around like I'm here in Miami now, or I'm in Slovenia, Croatia, wherever, sharing knowledge. Little funny picture, video at the end. I think this guy must be the inventor of pressure wave, yeah. But fortunately, we can use a different device by now. I think the energy flux density is much less than with the Duoclast device. So think about if you want to work like this, or if you want to join us with our guided Duoclast therapy. Greetings from me and my whole hockey team. Nice video at the end. This guy is a first league soccer player, because a lot of people coming to me after these sessions and tell me a lot of information, I'm a bit scared. And then I always show this. Professional soccer players, especially in Europe probably, not seem to be the most intelligent people in the world, if you see the way they behave on the pitch. I was talking to my ladies in the front desk about some issues, and then I heard the noise of the pressure wave device out of my room, and I entered my room and found him lying on the back, everything he prepared himself and applied the shockwave himself, like I did the day before. So I always say, if a soccer player can handle this, everybody can handle this. So don't be afraid, don't be scared, enjoy using the device. It's a perfect device. It's great fun using this device. Share knowledge, ask questions. I'm always looking for new information. So let's come in touch, stay in touch. And so we skip over to the live treatment part. So we've got a guy. He will say some words when we go to the bench, explaining what basically is his problem. I don't know him, so I will listen carefully, try to understand everything, and then I'm gonna start treating him like I would do it in my practice. And then we can meet again for some minutes to ask questions. Also, if you have questions after we finish this webinar, don't hesitate to contact Jeff or Joel or anybody else. They will bring you in contact, and then we can answer all these questions in the next days. So I hope you enjoyed the first two parts. Now we skip over. Cameras will be switched on. Now you will be scared because you see my face. Yeah, I'm the one without hair.
Oh, yeah.
This one, yeah. So I will take a chair over that the audience can see you. Then just in the beginning, because it's not a 2-hour treatment, tell them what 1, 2, 3 main issues you have, what you're suffering from, where you have pain, and what you want to be treated.
Yeah,
okay,
definitely. So hello, John Holloway here, and super excited to be getting some treatment today. This is awesome technology. But so some of the issues I'm dealing with, I had a total hip replacement at the age of 22. The reason I had got that was prior conditions of hip perthes, leg calf perthes, and so what that did was stop blood flow to the femoral head. It is necrotic and it grows back to form. So in theory, the hip was blown out. I had to get a hip replacement. So that solved some issues. But after the hip replacement for my quad and patella, so I had 8 months of bed rest, lost a bunch of muscle. In conjunction, I have 4 discs that are compressed. So what I'm dealing with as well is IT band syndrome, some bursitis, my psoas is inflamed. I have nerve pain shooting down, and then some plantar fasciitis.
okay.
So pretty extensive, but the 3 main points is IT band, bursitis, and plantar fasciitis.
Okay. Sounds like a 4-hour treatment today.
Yeah.
No, we make a break in between. Yeah, some advertisement. Do me a favor. Go in your back.
Okay.
Yeah. Put off your shoes.
Both.
Mm-hmm. Hmm? Mm. Mm. Painful?
Very, yeah.
Very painful.
Mm.
This side?
Not as much, no. So I've had 3 knee surgeries on this leg too: ACL, MCL, meniscus tear, and then when I had this issue, the leg wasn't growing, so they did 8 staples in each growth plate to catch up to growing. But this leg's good. This is the problem leg.
Okay, just put the bed down a bit. It's perfect. It's perfect like this. What I always do in the beginning is, because we have an issue which is affecting the whole kinetic chain on this side. So I have no idea in the beginning what's actually causing the problem after so many issues we find here. So checking rotation, checking muscle. What we can see is that definitely more muscles on the right side than on the left side. I always try what I showed you in the last spot. I showed extra rotation in the hip. Yeah, what you can see is it stops here. Do you feel pain?
It's tight.
Where do you feel pain?
Groin.
In this area. Yeah. So, and then compare it to the other side. This is basically what we expect. You see the difference. So before starting treating IT band hip area, what I always do is try to release the whole muscle tension in the whole system of the leg to find out what's left in this area. This is basically what I just showed you. Taking some gel inside, taking the big applicator. Setting is, I always set the device in the beginning without knowing how much pain the patient basically feels is. Set it up to 5,000 impulses, 20 hertz frequency, and start with the lowest intensity of pressure. And then we find out, try to find out the patient's threshold. So switch the device on. Do you feel pain? So we can increase 2 times. Tell me when you feel pain. Yeah? How much out of 10? 4. The best treatment intensity is when the pain threshold reaches 6, 7 out of 10. How much? 6. Looks perfect. If you look in his face, we can see it's the right intensity. Slightly moving in this area. What we want to do is we want to get as many pain receptors in the tissue as possible in this area. Who? How much? Yeah, no, you're fine. Tell me if it's getting less or if it's getting too much. You see, we don't need much pressure. The wave is entering via gel, so you don't need to press hard. Lighter. So we go up a bit. How much? 7, perfect. So after 1.8 thousand impulses, we could increase intensity by 0.5 bar. Yeah? Hmm? Okay. So clean him a bit and then check it again. Relax, relax. You see the difference? You feel?
I feel the difference.
So it's still not perfect. That's not what we expect. Yeah. But range of motion increases, pain decreases. Now we concentrate on the issues he just told us. Yeah. IT band, bursitis causing pain, plantar fasciitis causing pain. This needs to be treated now. Procedure is exactly the same as before. I start with the foot, plantar fasciitis. Painful?
Feels better already.
It already feels better. Yeah. So
A little sensitive.
where do you feel it most? Show.
Right here.
Okay.
Yeah.
So we concentrate on this setting exactly the same. Don't know how I don't know the patient. I don't know how much pain he's feeling. So I start with 1 bar pressure using some gel, go up to 5,000 impulses, 20 hertz frequency. And then we start treating the plantar fasciitis, looking for the most painful areas. No. How much? Tell me if it's too much. 4? How much? Yeah? That's 7. If it's too much, tell me I can go down. Okay. I always try to have contact to the leg, because if he's moving, or you feel the reaction of the patient. And again, it needs to be painful. Okay. Go up. Okay. Second step. Say again.
I didn't realize how much I actually felt that after you put that application on.
You see? What I do now is, before going upwards, do a retest again if this already changed something, because I want to find out what's causing his main problems. Yeah. So doing the testing again, check if anything is changing. Probably a bit.
Oh,
Yeah. But there's still something left, and now we need to concentrate on this.
I can already notice the noticeable change.
Pardon?
I can already notice the noticeable change with the plantar fasciitis. So they did a anterior approach, so they went to the front.
Yeah.
I got some scar tissue there too.
See? So we're treating now scar tissue, capsular, IT band, and the rest of muscles in this area causing the stiffness. Here we go, huh? Look at his face. That's exactly what I want to see. Yeah? I'm doing the treatment in this area with my fingers. I'm concentrated on IT band area, and I can feel the wave coming down until it reaches this place, yeah? Which shows me that the whole IT band is so tight that the wave gets transported downwards. So if you're not sure how many impulses you should apply now, if you don't know how many impulses you should apply now, a good indication would be until the vibration under my thumb below becomes less, because then I can tell the patient again, you see, now it's smooth, it's soft, it's more relaxed. And he really liked it. Can we have a close-up on this nice, painful face? How much? 7. With the device, you can feel restricted area without knowing the issue. In this area, I can really feel scar tissue, restricted capsular, and all this. You see? Here. Do you feel it sometimes in this area?
Oh yeah.
Oh, yeah.
Go up a little now.
Yeah. Yeah, vibration is most in this area. Now here. 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 You can feel it under my finger. Yeah. So moving around, I can feel vibration under my thumb and know exactly where his most tender spots are. Then whole IT band, capsulitis. How much? Tell me.
Good, you're good.
If it's too much, you need to tell me.
No, it's good.
Yeah. I don't go down with it without here.
Oh yeah. Oh. Oh.
So this basically is how a treatment with a injury or problem like this can look like. Yeah, it's not done after the first treatment, but if you just check how he improved in the last 10 minutes by just treating 3 or 4 different places. Yeah, we do another check.
I can already feel how my foot is just sitting there. There's a lot different.
Go down, go down, go down, go down. Yeah.
10 times better.
So basically, it's not done with the first treatment, but this is basically what I do 3, 4 times, and he will improve more and more and more. Some training, muscle training. Definitely, you need more muscle in this area. Yeah. Strengthen muscle. Yeah. But this is basically how it can look like.
Few questions.
So we handle questions then, and I just yeah.
Yeah, I'll pull the questions up.
Yeah.
And then you can just,
I can't see them, huh?
no, just stay where you were. It's perfect.
Like
Right there. That's good.
okay.
Perfect. I can feel a noticeable change.
Yeah.
Already up here, the plant there feels a lot looser and a lot less pressure.
All right, here's question number 1. After the initial treatment protocol of 3 to 7 sessions, how long do you take a break for before reinitiating treatment again?
I hope that I don't need to reinitiate the treatment. So basically, I hope that within 3 to 7 treatments, every issue is done. So a bit depending on the problem I have. So if we're treating, for example, bursitis, 3 to 7 treatments should be enough. If we're treating a muscle injury with a normal paying patient in the practice, 3 to 7 treatments is enough. According to, we're treating every 5 to 7 days. We are applying one treatment. So there's just few indications where I really need to do more treatments, like spasticity, because this I can't treat it forever. So this is a regular patient coming every 4 to 6 weeks for one treatment, and this should last. So basically, 7 treatments should be enough.
Okay, great. The next question Can you please clarify the age contraindications if you're not doing it for OSD? You mentioned that you treat the youth soccer team. I assume they're less than 22.
Yes, you are right, absolutely right. The main contraindication, according to children, is we are never shooting at the growing zone. So because we don't know how growing zones behaving, it's a kind of off-label treatment. That's how we handle it in Germany. So I treat, of course, all the youth players, avoiding to shoot at the growing zone. So if he's suffering from a muscle injury, I don't have any problems treating this area. According to the Schlatter disease, which is apparently one of the most, the biggest indications I have in my practice every day, it's just about how to apply the shockwave. I just show it. If I'm shooting like this, I can hit the growing zone. But if I shoot like this, or the tuberositas, I never hit the growing zone because it's a 90-degree angle, and just going to the tuberositas. If I just move like this or like this, no problem by hitting the growing zone. We're talking about epiphysis, yeah, which is actually the growing zone. Tuberositas, or in the back of a calcaneus, it's an apophysis where I'm basically allowed to apply shockwave. It's just about we need to make it clear to parents, to the patient, that we are avoiding shooting at the growing zone, yeah, or ligament ruptures, muscle ruptures, or whatever is no real contraindication.
Please reiterate the number of treatments needed and the frequency of treatment. What is the post-treatment instructions and return to play protocol?
Okay. The rough number of how many treatments we apply is every 5 to 7 days, 1 treatment, 3 to 7 treatments in total. This is the rough number. If you have professional athletes, you can increase the number of treatments. Or if you have a patient who really wants to pay the higher number of treatments, then we definitely do more. The basic information is as much energy in the tissue is increasing the healing process. So if you do it daily, we can increase it. So it depends on if the patient is willing to pay. What was the second part of the question?
What is the post-treatment instructions and return to play protocol?
Depending on the injury. Basically, if we're looking for ligament ruptures in the ankle, stabilization, exercises, cycling, running, increasing the load, basically the same with the knee, the same with muscle injuries. It's always the same. What I do, one very important thing, because actual studies are really interesting about it, if we have tendon problems, yeah, we are increasing scleraxis. I mentioned this before by doing shockwave, pressure wave. There is another part with post-exercise stuff, and this is isometric training. Because what we know is that isometric training is doing exactly the same thing according to scleraxis, just a bit lower than the shockwave. Isometric training is increasing scleraxis, whereas cortisone or painkillers decrease scleraxis. So this is a very good fitting for everything when tendons are injured. And the best exercise for legs, isometric exercise for injuries, is wall squats. Doing wall squats, wall sitting is the best exercise, and you can reduce blood pressure by it too.
Awesome. All right, to clarify, you can use ice cold treatment during acute first 48 hours. Previously understood to only use heat after radial shockwave due to cold stopping the treatment.
I need to go and have a read because it's just too much information.
Yep.
Show me where.
Can use ice cold
Yeah.
treatment during acute first 48 hours.
Yeah. Yes. For one important reason. What we know in the beginning, first treatment on the pitch, for example, is ice cooling, because we don't want so much fluid in the injured area. Otherwise, we need to work with more shockwave, pressure wave to reduce the swelling in the beginning. Then we're using this after the pressure wave. After every treatment, we're trying to apply any cooling. we're doing this afterwards, because if we would do it before, we would decrease the pain feeling of the patient. So then we don't reach the proper pain threshold, like local anesthesia, for example. If we do an injection with local anesthesia, we know that pressure wave is not working because we don't reach the pain threshold. If we do it after the therapy, we know that we can increase the reaction of every pressure wave therapy. Next one.
Here's a good one. Couple good ones. How do you combine shockwave with PRP?
I don't combine it because I'm not allowed in Germany to do PRP. It's special doctors doing this in Germany. That's different. But basically, we combine this, yeah, and it doesn't matter in which part of injection of PRP you're using shockwave. You can do it before, do PRP afterwards. You can do it directly after PRP injection. You don't get a problem by doing this.
Another question. Does the treatment have any efficacy for post-traumatic neuropraxia or pressure or stretching to the nerve? Is
No.
there any use in surgically repaired nerve?
No. I understand this correct. If we have an influence on the nerve, show me. Ah, no, no. We don't do, we can't increase the nerve healing. So nerval tissue healing is difficult, yeah? We know that around every nerve there's a tissue which also makes nerval gliding. This is something we can increase, but after this, no information about it.
The last question. Does anybody have any additional questions? If you want to post them right now, we can take an additional question. If not, I'll turn it back over to Alex for a wrap-up summary. No other questions? Oh, no, nothing else. That's it. There's one more question. What is your email and contact info? Want to know. We'll get that out to you guys.
This will work. Just contact Jeff and Joel, and they will pass over an email address, and then we stay in contact. That's no problem. Just keep in mind it's a 6-hour difference to Germany, yeah?
Make sure you
don't complain if you write at 3 o'clock at night and I'm not answering, please.
Just curious, why did medial ankle treatment improve his hip external rotation?
Why affecting the tibial posterior muscle tendon in this area? I can affect the whole kinetic chain, which is running up until I reach psoas muscle. Psoas muscle is one of the most important core muscles affecting everything what is concerning our legs. So by hitting the tendon in this area, it's a bit of traditional Chinese medicine. I can decrease the whole kinetic chain. Then I can see what actually stays. Yeah, we have the same thing with the arm. So we know everything knows. I never can't. It's colon 4 in Germany and Chinese medicine. I know it has a special name. Dr. Tin, Dr. Lin will kill me now because I forgot this. They told me. But this point, and this point is connected to the arm. So if I'm not quite sure what is actually causing shoulder problems and range of motion problems in this area, I always start with one of these 2 points, because then I can reach a relaxation of the whole muscle kinetic chain. Yeah, and basically the same as with the leg. And then I can concentrate on whatever tendon or muscle in the shoulder is affecting the problem.
All right. There's some interesting ones, but I think some of these questions you have to get in depth with Lynn on this. Wesley H. Wesley, that asked Dr. Deitch is in Germany, so we'll make sure that he reaches out to you directly. And I think this is a good one just for kind of a last question that Lynn had asked. What do you do if a patient cannot tolerate high intensity energy? Do you increase the number of treatments and number of shocks that you can't use anesthesia?
The problem is I need to make sure that you can tolerate it. I've got two possibilities with the device to to help myself to apply it. First is the lowest pressure input is 1.0 bar. So I've got a special analgesic setting. With the analgesic setting, I can reach about 0.8, 0.9 bar pressure for the beginning of the treatment. Or a very easy thing is move faster. If you move faster, the concentration of high energy in one spot is less. So if you have a tennis elbow and I concentrate on the spot, on this spot, and it's too painful, just move faster, because then it's not the full energy per frequency is entering the tissue. So then you have the possibility, you saw it just before, after several amount of shots, the pain level is decreasing, and then you can concentrate on this. So this is the only opportunity you have. Yeah. For further tricks and hints, text me.
Dr. Von just wanted to know, it's large intestine 4, LLF.
Thank you. Yes.
LILF.
Yes. I try not to forget it anymore.
I can tell it feels a lot better just after one treatment.
Again, say it loud.
It feels a lot better after just one treatment. Usually what I've always noticed is when I lay down, this leg will sit off to the right more, and this will kind of sit in this position. But now they drop at the same, which I've never, since the hip replacement experience. Usually it's pretty tight like this.
So if anybody wants to continue the treatment, yeah,
Feels good.
now it's easy.
Yeah, it feels really good. I'm excited to stand on it.
Great.
See how it feels. So thank you. Thank you.
That's awesome. So you want to do a quick wrap up? And,
Yeah.
we'll-
Just some very, very important informations about doing this. Yeah. First of all, try to decide which device you're using. That's the first thing, which is one of the most important things. I'm treating professional soccer players. They are worth millions. And if I would try it with a crap device, they don't come. First thing. Second thing, go for it. It's great fun. You see how happy he is after the first treatment. The reaction of your patients will improve your business a lot. Don't be scared about using it. Yeah, that's I think that's the biggest message. Yeah, don't be afraid. Just go for it. Call these guys. Try it out. If you have another device, compare these devices. Make yourself sure that I'm not talking crap. This is the most important thing. Yeah, enjoy it and reach out to me.
Awesome. Wanted to thank everybody
For attending today's webinar, and we'll look forward to seeing you back on a future webinar that we run. Thank you
We
very much,
will.
Alex.
See you
Thank you,
definitely
Joel. You
soon.
want to bow
Joel,
out?
Thanks for the treatment. I feel
Let
better.
me
you're welcome.
step
Appreciate
in.
it. Thank
Here
you.
we go.
take a quick. There we go. Hey,
Where am I in the picture? I don't
Email us.
There we go. Hey,
Right
there we
here.
are.
And for those who are still on, we're gonna do it.
Thank you guys for attending.
Yeah, it's good.
Ready?
I seriously
Preview of the, don't turn it up yet.
Oh, you want to do? What do you want to do?
Experience my leg dropping.
Yep.
like that.
Ready?
That felt really
Yep.
good.
Nice.
Back there, I felt
Yeah,
good.
you will see the difference.
Training
And now you know
center
how
coming shortly.
you can do it. Now you can treat
Ah,
yourself. You know what basically to do.
Thank
I
you guys.
explained everything in
My
different.
stiletto's loosened up a little
Yeah.
too.